Hey y'all, it's me, Dr. Smearman, Gyno Girl. Welcome back to my show today. A topic that gets asked in my office a lot when patients have spouses or partners with erectile dysfunction who use Viagra. They're always like, hey, Dr. Ron, can I use his Viagra? What's the deal? Can I do it? What's going to happen if I do it? So I'm going to do a quick video today on Viagra for Women. Is that a thing or not? Let's go. Let's get at it. Hey y'all, it's me, Dr. Smearman, Gyno Girl. I just will reintroduce myself. I'm a sex med gynecologist in downtown Chicago. I am a menopause specialist, and I treat women in Chicago. I'm licensed in Chicago. I'm licensed in California, Indiana, Wisconsin, and Arizona, so I can also do televisits in those areas. I have a podcast called Gyno Girl Presents Sex, Drugs, and Hormones that I launched in January. You could join me over there. But today, and please like and subscribe to my channel. Today, we're going to talk about something I get asked about not infrequently, which is, can I use my boyfriend, spouse, or whoever else Viagra? And so let's talk about what Viagra is and whether or not we can use it. So Viagra, or sildenafil, is a phosphodiesterase 5 inhibitor. And it was actually discovered in the late 1990s, when the Pfizer group was looking for a new medication for chest pain, angina, as well as high blood pressure. So the thought is, like, if we vasodilate, our arteries, then, we can reduce our blood pressure, maybe reduce chest pain. So they created this phosphodiesterase inhibitor, which inhibits vasoconstriction, so allows for vasodilation. And it didn't work as a blood pressure medicine, and it didn't work to reduce in angina or chest pain, but the men in the group certainly got a lot of erections. So this was how it came to be and was studied then for erectile purposes. And this was around the same time when people stopped using the term impotent, just like we stopped using the term vaginal atrophy. So they also stopped using the term impotent and started using the term erectile dysfunction. And it works obviously very well for certain men in certain categories. And so a lot of women are like, what about us? Well, Viagra has been studied in women, I think, not that much recently. Most of the data is from about, 18 to 20 years ago. And one of the largest trials was looking at premenopausal and postmenopausal women with varying doses of sildenafil to see if it improved their overall sexual function, which it did not prove to be statistically significant to improve their sexual function. And so that was a little bit of a downer that, and it's not been enough of an issue, I guess, for pharmaceuticals to invest in studying it in women. But I will say there are some categories of patients who probably it would benefit. If you think about in the menopause, we have less blood flow to the clitoris shrinks, you get a little bit atrophic. And so what happens is, if the thought is if we can increase the blood flow to the clitoris, like we increase the blood flow to the penis with sildenafil, then maybe we could improve orgasms. And it just hasn't shown to be the case for the majority of patients. I will say there have been some smaller trials that have looked at women who have SSRI-induced sexual dysfunction, arousal, and orgasm issues. Now remember, I did a video on hypoactive sexual desire disorder where I talk about the sexual brain and how there are things that can put us into excitation mode and things that can put us into inhibition mode. So neurotransmitters like serotonin, hormones like prolactin, those can inhibit our sexual desire and our sexual arousal and orgasm. And then you have things like testosterone, oxytocin, dopamine, norepinephrine that can excite us. And so it's a tipping point. We call it the sexual tipping point of what you have on board when it comes from a biological perspective, at least. We know other things can tip you into wanting to have sex and not wanting to have sex, including a good or bad relationship, issues around your own concerns, psychological concerns, anxiety, depression, OCD. So there are some patients who, when they are severely depressed, they have no desire to do anything. And so therefore they have complete anhedonia. And so then when they get on an antidepressant, they actually do benefit from an improvement in sexual function. But there are a small subset of patients who have sexual dysfunction that lasts for more than 8 weeks because these high serotonin levels then start to inhibit their desire, arousal, and they cannot orgasm. And in this group of patients, it has been studied. And so this is an SSRI-induced sexual dysfunction. It has been studied. We've seen it work for those groups of patients. I've used it in certain patients with some success. It's a little bit of titrating because we don't know the side effects are going to be the same for women. The nausea, the flushing, that kind of thing, the headaches. That's something we have to look at and study, obviously, but it hasn't been studied in any great capacity. So, and other groups of patients that there's some smaller studies suggesting it would work, are those who are diabetic, who have some sort of, what happens with diabetes, you have neuropathy, you have diminished sensitivity in the nerve endings, a diminished blood flow to the area. So there are some patients who have improvement based on that. There are patients who have multiple sclerosis, spinal cord injuries, that kind of thing, which is shown to improve their overall sexual function and orgasm and arousal. Again, we need obviously more data to support the use of Viagra in women. Unfortunately, we can't say across the board that it'll help, but I do use it in that subset of patients who have SSRI-induced sexual dysfunction. I do want to mention there is sildenafil is often compounded in the form of a cream or a topical agent along with like nitroglycerin or other agents that might improve blood flow to the clitoris. And they're told there's things like an screen cream and, there's other compounded forms of sildenafil, which is, again, a PDE5 inhibitor. It's thought to increase blood flow to the area. So some patients do get this compounded from their clinicians. There is a medication on the pipeline that you guys should know about. It is a form of sildenafil cream. It's going to be applied topically. I think it's like a 3.5 or 6% sildenafil cream that you apply topically to the clitoris and the vulva all around. And it is being studied for female sexual arousal dysfunction. And also, thought to help, obviously, if you can improve arousal, many times you can improve orgasm. So that is on the pipeline. Hopefully that will get FDA approved and we'll have it available. Otherwise, we can try to use a trusted compounding pharmacy and try to compound it for some patients. Anyway, the long and short of it is Viagra has not been the same for women as it is for men, as we could anticipate. And, although I would like to say, go ahead and pop your boyfriend, husband, partner's Viagra and see what happens, I wouldn't recommend it. If you do have a sexual medicine specialist that you work with, then definitely that is something that we can discuss. I have a discussion with my patients about it. We try going low dose to high dose and see what happens. And we go from there. So I think that is something to remember. And, hopefully this new cream, this sildenafil cream will be on the pipeline soon. But otherwise, we have had different forms of compounding agents that we use. Additionally, at the Ishwish Society meeting this year, there's going to be a whole panel on orgasm dysfunction, and the newest data on what we know about orgasm dysfunction is going to be released along with a scientific paper to guide clinicians. So I'm waiting to hear some more of the data and to know how I can help patients with orgasm dysfunction. Remember, we always have to look at the clitoris, we have to look at the clitoral hood and make sure there's no adhesions that might be impairing orgasm. We have to do a biopsychosocial approach to low orgasm or no orgasm. And sexual therapy is always in the mix. I'm going to stop right there because the question was really around Viagra for Women, which reviewing Viagra for Women really in the subcategory, what I use it for are SSRI-induced issues when it comes to those antidepressants that we use that increase your serotonin. This is a subset of patients that I've seen even in my practice to be successful for improvement in sexual function, arousal, and orgasm. So that's it for now. That's it, Viagra in a nutshell. Talk to someone that is trained in sex medicine to get you some better understanding. But there is hope, and that's the main key in here. And I'm here to educate so you can advocate for yourself. So I'll do more later, but I just wanted to touch base on Viagra for Women today. And so I hope you guys enjoyed our quick little episode today, and we'll be sure to talk more later about other interesting topics. Please leave me some comments about what you might want to hear about, and I'll see you next time.